Understanding the chiropractic spinal adjustment process. Chiropractic spinal adjustments. Chiropractic care centers around the relationship between the spine and overall health. A typical chiropractic spinal adjustment examination involves the patient lying face down on a specialized table, allowing the practitioner to assess the spine's alignment and movement. This assessment, often called palpation, involves feeling along the spine from the tailbone to the neck, checking each individual vertebra for proper motion. The practitioner is looking for areas where vertebrae may be restricted or not moving correctly in relation to the vertebrae above and below. In the mid-back, thoracic spine, the presence of rib attachments makes this area feel more rigid. The neck, cervical spine, and lower back, lumbar spine, generally exhibit more individual movement. Areas of restricted movement where the spine feels stiffer than the surrounding areas may indicate a misalignment. If a restricted area is identified, the practitioner may apply a gentle, controlled force or impulse to the joint. This spinal adjustment aims to restore proper movement to the affected vertebra. Following the adjustment, the practitioner will reassess the joint's movement. Practitioners may also assess leg length discrepancies. While not always indicative of a spinal issue, a noticeable difference in leg length can suggest a problem in the spine or pelvis. It's important to note that a difference in leg length can have various causes, including pelvic tilt, muscle imbalances, or, less commonly, an anatomically shorter leg. Further examination is needed to determine the root cause. The cervical spine can be assessed through various methods, including checking the rotation of individual vertebrae. Restrictions in rotation may indicate a misalignment. Adjustments to the lower back often involve the patient lying on their side while the practitioner applies a specific technique to restore movement. Neck adjustments can be performed in several positions, including lying on the back or sitting. The practitioner will carefully assess the neck vertebrae before applying a gentle adjustment to the restricted area. Following the adjustment, movement is reassessed, and the patient may receive a neck stretch or massage. This process of palpation, adjustment, and reassessment is central to chiropractic care. The goal is to ensure proper spinal alignment and movement, allowing the entire structure to function optimally. Misalignments can affect the nervous system, potentially impacting motor function, sensation, and coordination. They can also contribute to degenerative changes like arthritis and cause pain. Spinal manipulation versus chiropractic. While the terms are sometimes used interchangeably, there are nuances. Spinal manipulation is a broad term referring to manual techniques used to restore joint mobility. Chiropractic adjustments are a specific type of spinal manipulation, often characterized by a high-velocity, low-amplitude thrust applied to the joint. Chiropractic care also encompasses a broader philosophy that considers the relationship between the spine and overall health, often including lifestyle advice and other related therapies. Other healthcare providers, such as osteopathic doctors and some physical therapists, may also perform spinal manipulation, but their training and approach may differ. Chiropractic benefits and disadvantages. Benefits. Many people find chiropractic care effective in relieving musculoskeletal pain, particularly back pain, neck pain, and headaches. It can improve joint mobility and flexibility. Some patients also report benefits for other conditions, although more research is needed in these areas. Disadvantages. Chiropractic care may not be appropriate for everyone. Individuals with certain conditions, such as severe osteoporosis, spinal instability, or active fractures, should avoid chiropractic adjustments. It's essential to discuss your medical history with the practitioner before undergoing treatment. Chiropractic spinal adjustment side effects. While generally considered safe, chiropractic adjustments can have some side effects. The most common side effects are mild and temporary, including muscle soreness, stiffness, or localized pain. These symptoms typically resolve within 24 to 48 hours. In rare cases, more serious complications, such as nerve damage or stroke, have been reported, particularly with neck manipulations. It's crucial to choose a qualified and experienced practitioner to minimize the risk of adverse events. How do chiropractors know where to do a spinal adjustment? Chiropractors use a combination of methods to determine where to perform an adjustment. Palpation, as described earlier, is a key technique. They feel for restrictions in joint movement, misalignments, and muscle tension. They may also use other diagnostic tools such as X-rays, to assess the spine's structure and identify any underlying conditions. Patient history, including symptoms and previous injuries, also plays a role in determining the appropriate treatment plan. Does chiropractic spinal adjustments really work? The effectiveness of chiropractic adjustments is a subject of ongoing research and debate. Many studies have shown that chiropractic care can be effective for certain musculoskeletal conditions, particularly back pain. However, the evidence for its effectiveness for other conditions is less conclusive. It's important to remember that chiropractic care is not a cure-all, and results can vary from person to person. It's best to discuss your specific condition with a healthcare professional, including a chiropractor, to determine the most appropriate treatment options. If you are experiencing musculoskeletal symptoms such as pain, numbness, tingling, or limited flexibility, consulting an experienced and reputable chiropractor may be beneficial. It's crucial to research and understand the potential risks and benefits of chiropractic care before seeking treatment.